Imagine waiting over 6 months for a surgery while in excruciating pain, or picture having to drive hours just to access basic healthcare needs because there are no facilities nearby that can offer timely care. Unfortunately, this is not a rare occurrence for many Manitobans. It's a reality that affects thousands of people every year, and it's time we address it. Today, I am here to discuss why the Manitoba government should allow private healthcare facilities to operate alongside our public system as a solution to the challenges we face in healthcare. As a born and raised Manitoban, I've heard countless stories about the difficulties people face with our healthcare system. I've even experienced it myself. Last summer, I suffered a sports injury and had to wait months for an MRI. The delays led to improper treatment and ultimately a re-injury that forced me to be out for the 2025 season. I know firsthand the frustrating and often devastating consequences of inadequate care. While you may not live in Manitoba, many of the challenges we face, such as long wait times, overcrowded hospitals, and limited access to care, are shared by people in other regions, including the US. The reality is that when Canadians have to travel to the US for quicker care, it can affect wait times and resource allocation there too. This is why the issue is relevant to everyone. Today, I'll discuss the problems with Manitoba's healthcare system, identify their causes, and explain how introducing private healthcare facilities can provide a practical and effective solution. Manitobans are currently experiencing severe healthcare issues that hinder access to timely care. One of these problems being wait times for their healthcare needs. According to the government of Manitoba, wait times for an MRI can range from 22 to 56 weeks depending on the location. This is an unacceptably long delay for people in pain who are waiting for a diagnostic test that could be crucial to their treatment. Another problem is understaffed hospitals and rural access issues. Hospitals are increasingly understaffed, and those in rural areas often have to travel long distances for even basic care. This lack of access contributes to the problem, particularly for urgent and specialized medical needs. Lastly, another common problem is overcrowded emergency rooms. Our emergency rooms are constantly at capacity, leading to dangerous delays for critical conditions. This issue is not just inconvenient, it can cost lives when patients can't get timely care. In an article by Deepo Famawayo titled "Canada's Healthcare is a Myth," she critiques Canada's healthcare system, sharing her personal experiences with long wait times, lack of communication from healthcare providers, and inadequate care. Famayo questions the notion of free healthcare, arguing that a system that is inaccessible, inefficient, and dismissive cannot be considered ideal. Even when compared to the US, she highlights the personal toll that delayed treatments and mismanagement of urgent medical conditions can have on patients. To understand how we reach this point in the crisis, it's important to examine the underlying causes of these issues. The challenges we face are rooted in systematic issues related to lack of alternatives, over-reliance on the public system, and underfunding. In Manitoba, we have a single-tier healthcare system, meaning there are no private options for people who could afford faster care. As a result, according to Velocity Global's article, patients who might be able to pay for quicker treatment elsewhere are left waiting for long periods without these alternatives. The system becomes overwhelmed. Over-reliance on public health care is another problem we face. With over 1.2 million residents dependent on one system, the strain on resources is immense. The lack of competition leads to bottlenecks, causing delays and inefficiencies in our system. Lastly, the problem of underfunding and misallocation of resources. Our hospitals are underfunded, which contributes to staff shortages, long wait times, and inability to meet growing demand for care. In many cases, resources are simply not distributed effectively enough across the province, leaving poor health care for those in rural areas. While the causes of these problems are significant, there is a clear solution that could relieve the strain on the system and improve healthcare for all Manitobans. Allowing private healthcare facilities. But there is a solution. By introducing private healthcare facilities alongside the public system, we would have several positive outcomes. The first being relieving pressure on public facilities. Allowing patients who can afford to pay for private care would reduce the burden on public hospitals, enabling them to focus on those who rely on the system. Velocity Global's article titled "Private versus Public Healthcare" stated private healthcare insurance policyholders generally have fewer long-term repercussions and faster access to care. Private healthcare options would provide patients with faster access to necessary treatments and procedures for those who can afford it. This would drastically reduce the wait times and prevent healthcare complications that often arise from delayed treatments. This is proven in the times and prevent the health complications that often arise from. This is proven in the Get Covered Kansas article, which they discussed the trade-offs between private and public health insurance, highlighting that private plans often provide quicker access to care due to shorter wait times, potentially preventing complications from delayed treatment. The article emphasizes that private insurance may better meet urgent and specialized healthcare needs, which can lead to improved outcomes and overall efficiency for policyholders. Lastly, this would improve resource allocation and innovation. Introducing private healthcare would encourage competition, which is beneficial for improving the quality of care. It would push public facilities to innovate, streamline their operations, and provide better outcomes for patients. With more resources available in the system, both private and public facilities would be able to serve the population more effectively. By embracing private healthcare facilities, Manitoba can begin to create an effective and efficient healthcare system that serves the needs of all its citizens. Today I've discussed the problems facing Manitoba's healthcare system, the causes of these problems, and how introducing private healthcare facilities can provide a viable solution. Whether you live in Manitoba or elsewhere, I urge you to advocate for a healthcare system that prioritizes timely, high-quality care. Share your thoughts with friends and family about how we can work together to improve healthcare in Canada. The more people who understand the benefits of a system that includes both private and public options, the closer we are to finding a solution. Finally, imagine a Manitoba where no one is left waiting for care, and everyone can access the treatment they need without delay. By allowing private healthcare alongside public options, we can turn that vision into a reality. Together, we can create a healthcare system that works for everyone.